Right, well, I've been wanting to get this video out and have been unable to because I don't have a video camera, so I had to borrow this just to get just a few videos done that I've been meaning to get done. I'm smack in the middle of my 13th week. It's a Wednesday, so it's right in the middle of the week of my 13th week. I saw my doctor at the end of my 12th week, and I am able to put partial weight now. I went from non-weight bearing to partial weight bearing. So I've been partial weight bearing for a couple of days now. That involves wearing my boot that goes all the way up to my knee, and I have to have my crutches. So I'm not putting partial weight on my lonesome, both the boot and the crutch. This video is just to show you the exercises for the brachy-toe that was given to me. Probably it'll start them about the 9th or 10th week, whatever your doctor tells you, but that was around about the time I was told to do it. And see if I can get a close-up of my foot here. And as you can see, it's the 13th week, and still the toe has a lower profile than the other toes. You can see that. But if you look on my blog, you can see that when I got out of surgery, this fourth toe was literally like that. It was stuck in this position. It was overcorrected on purpose in this position, so that after this is all said and done, I wouldn't have a floating toe. It still wouldn't be above like it was at the beginning when I had brachy. So it's still a work in progress. So the exercises I was given to do or shown to do was to grab it at the very base, not at the center nor at the tip, to bring it both forward and backward. And so I would grab it at the base, and it was very, very gently. When you're first doing this, it's just a very gentle motion, because you're stretching out that tendon, and you also don't want to damage anything, of course, that's been done already. I had the one stage done, so I have a plate in here that's about yay long, and it has 6 screws. So just very gently at the very base, just bringing it forward. I was told to do it about 2 minutes, 3 times a day. So I did that. Sometimes I would forget, but I did do it. I found after a while that it was very hard to put, because in this position my knee is sort of at my chest, and it got to be a little difficult because of the flexibility actually in the ankle that wasn't there due to the fact that the bone graft was taken from the heel. It affects your whole ankle. So I found it easier to actually just take and go from behind, and I would just take my thumb and I would go right at the base, right here. I wouldn't even put my finger on the toe. I would actually put it just sort of at the base here, and I would then just do that. I would just push like so. So that's the way that looked, like that. And at the beginning, it's just a very small motion. Now that I'm in my 13th week and I've been doing it since my 9th week, I can do it without basically any pain, and I can sort of bring it all the way forward without any pain whatsoever. And sometimes I pulse it, and sometimes I just keep it there for a little while. Now that it's sort of on the 13th week, I'm comfortable with sort of just keeping it there for a little bit and stretching out that tendon. So it's still a work in progress. I'm hoping that it will come up a little bit more, maybe when